Nous allons enchaîner avec la sœur Thérèse Fila, qui est responsable de la fondation VETZECOM, qui va nous présenter Socioeconomic Challenges in Surgical Management of Patients with Post-Rheumatic Valve Disease. Ma sœur, vous avez 8 minutes, s'il vous plaît.
Thank you very much for giving me the chance to continue to share on our experience. I'll be presenting on the socioeconomic challenges in the surgical management of patients with post-rheumatic valvulopathies. Our outlines will be as follows. We will have the objectives, the historical perspective of the cardiac center, concept of health financing and major sources of health financing, and socioeconomic challenges and the scoping strategies put in place by the cardiac center, and conclusion. Our main objective of this presentation is to share the experience of the Jour Cardiac Center surviving amidst the socioeconomic challenges, with the specific objective to review socioeconomic challenges in the surgical management of patients with post-rheumatic valvulopathies, and also to discuss the strategies put in place by the Jour Cardiac Center for the survival of the institution and the patients, and also to solicit more suggestions to improve the socioeconomic challenges of management of Cameroonian cardiac patients. Historical perspective of the cardiac center. St. Elizabeth Cardiac Center Shishong was initiated in 2002 and inaugurated in 2009, thanks to the dream of Don Claudio Maglioni, an Italian priest, with the project collaborators Bambini, Core Fratello, Tertiary Sisters of St. Francis, and the Capuchin. Between 2009 and 2013, the missions were principally run by the expatriate professionals, and in 2013, January 2013, we got the first resident cardiac surgeon, which reduced the expatriate missions. The resident team performs various cardiac procedures for congenital and acquired heart diseases, both on adults and children. Why Cardiac Center in Shishong? St. Elizabeth Cardiac Center is located in Shishong, Bui Division, Northwest region of Cameroon. And the rationale behind this location was because, first, Shishong is the center of the Tertiary Sisters of St. Francis in Africa. Shishong has a well-established hospital since 1935, and also the presence of the Kali School of Health Sciences since 1954. That gives the students the opportunity to practice cardiac care. Our concept of health financing, according to World Health Organization, health financing is referred to as assurance of financial resources to cover and sustain healthcare expenses over time, and also healthcare financing as one of the principal dominant and pillars of sustainable healthcare system. These include health insurance, where population pays in regularly to health insurance, so that with time they can find their health concerns may be financed fully or partially. We also have out-of-the-pocket financing, where the population covers their health bills individually from their pockets. And all of us know this is the dominant method in Cameroon. What is the cost of cardiac surgery? The cost of cardiac surgery in Shishong is averagely 3.8 or more, and this may be relatively high for average Cameroonians whose per capita income stands at about 517,500. Also, we put surgical management. It may require around 120,000 francs or more per year for follow-up. And we have an average number of 200 persons on our waiting list for surgery. We may ask ourselves, can an average Cameroonian afford cardiac surgery from the pocket? What are the needs of these patients with post-rheumatic valvulopathies? Where else in the world are these challenges faced and why? Socioeconomic challenges. Patient-related socioeconomic challenges will include poor compliance to medical advice, low income and poverty, poor discipline and education, and unhealthy beliefs. System-based socioeconomic challenges will include poverty, few health insurance scheme, impact of Anglophone crisis as mentioned in the earlier presentation, prolonged power cuts, network accessibility, diminishing number of overseas sponsors, and expensive medical supplies. What are the scoping strategies put in place by the Cardiac Center? We have a social case office which takes care of the socioeconomic needs of the cardiac patients, offers psychosocial and economic assistance to patients living with cardiovascular diseases. And in this office, we have one full-time person who has the opportunity to mobilize donors and volunteers to support the plight of the cardiac patients. What is the limitation of this office? It is an internal arrangement and has no civil status for existence and fundraising. And for this, in order to complement this shortcoming, the Archbishop Paul Vedrekov Memorial Heart Foundation was created since 2011. What are the functions of this Heart Foundation? First is fundraising, and it is done through membership contribution, fundraising through events, soliciting donations from organizations and individuals like all of us seated here, enterprises and gift box in the Cardiac Center. This foundation also accompanies patients and families through psychosocial support, and also there are other strategies put in place by the Cardiac Center, which include empowerment of the population on self-reliance and wealth creation.
1 minute, please.
And intensifying our outreach consultation. To conclude, be in solidarity with us, be part of the solution by becoming a donor, a member of the Archbishop Paul Vedrekov Memorial Heart Foundation. Together we can uplift the challenges in the management of rheumatic valvulopathies. In fact, to heal a heart is to strengthen humanity. Thanks.
Thank you, Sister Philae.